Hello, I am Dr. Michael Perchinsky, cardiac surgeon here at the Royal Jubilee Hospital. In this short video you're about to watch, it will cover many of the important issues as you recover from your cardiac operation. We ask you to refer to our cardiac teaching booklet that we have given you, and many of these points are also covered in our cardiac surgery website. We wish you well as you convalesce from your cardiac operation.
Welcome to the discharge teaching video for post-open heart surgery. I'm Rachel, one of the nurses on 3 Northwest. And when you're about to be discharged, your nurse will go through all of the information that is specific to you and your care. And in this video, we're going to go over the things that you can expect for when you're going to be going home. When you've been discharged, we'll ask you to see your GP or nurse practitioner about 7 to 10 days after you go home. And at this appointment, you can have your chest tube sutures removed and any staples that you have as well. At this appointment, it's also important to have your white book with you. You can take this with you to your GP and show them all of the information that we've given you about any follow-ups that you need to have, as well as your medications. You want to go over those with them as well, and have them take your heart rate as well as your blood pressure. Next, we get you to see your cardiologist or your internist at about the 6-week mark, and at this appointment you're going to be okayed for whether you can go back to work or not. The timeline of this depends on the type of job that you have, as well as driving. You need to be okayed to drive or your insurance may be invalid. So you want to double check those things before you do any of them. Traveling is another thing that you want to be okayed for before you go ahead and book any trips. At 8 weeks, we have you see your surgeon. And again, not everyone is going to be required to follow up with their surgeon. Some of our docs are okay with you following up with your internist or cardiologist and just coming to see them if there's any concerns. And we'll let you know one way or the other which one you need to do. Your nurse, again, will review all of this information and it'll be written down in your white book with you that you get to go home with. If you don't have a GP or a nurse practitioner, it's okay to go to a walk-in clinic to have your sutures or your staples removed and to have your medications reviewed as well. As for medications, your nurse will review all of this with you, but patients can generally expect to go home on medications for their blood pressure and or rhythm, something for cholesterol, and to prevent blood clots from forming. These new prescriptions are your medications now. If you have any medications that have been prescribed by a different specialist, you'll need to see them for any concerns regarding those medications. And your GP will now do the renewals for you for your medications. As for pain medication, you've been getting extra strength Tylenol here in the hospital about every 4 to 6 hours. It's a good idea to continue this while you are at home for the first little while, and then you can just taper it down as needed. If your pain is not covered by the Tylenol, it's important to go and see your GP just to get checked out. For heart valve patients, you'll be given an identification card that has information about your heart valve on it, and then in the mail you'll be given one that is a more permanent laminated copy, so that'll be sent to you once you're home. And it's also a good idea to get a medical alert bracelet that has information about your heart valve on it as well. In order to protect you from endocarditis, it's important to have prophylactic antibiotics if you have any dental work done. And this is okay to start having done at about 3 months after your surgery. By the time you're ready to go home, your incisions will most likely be open to air. If you do need to have some dressings on for a couple of days, we'll arrange to have home nursing care come in and do that for you. When you're at home, it's important to watch out for signs of infection for all of your incisions. A little bit of clear yellow or slightly watery blood coming from your incisions is normal, and that can take up to 2 weeks for it to go away. If your incision is draining pus or a greeny yellow drainage, you want to go and get checked out. It's also important not to put any lotions, creams, or oils on your chest, and try to avoid touching and scratching your incision. Itchiness, it's annoying, but it is a normal part of healing. When you're having a shower, it's okay for your incisions to get wet. You don't want to have a bath and submerge your incisions in water or a hot tub or a swimming pool for at least 6 weeks or until your incisions are fully healed. When you are having a shower, you may want to sit when you're having a shower to conserve your energy and just in case your balance is not quite up to par. When you're having a shower, you go in, you get wet, and then when you're done, just pat your incisions gently dry. And you also want to keep your incision out of the sun for at least a year, just to help with scarring. As you know, here in the hospital, we would wake you up every morning and weigh you. It's really recommended that you keep weighing yourself once you're at home as well. You may need to get a new baseline because our scales may be slightly different. When you do weigh yourself every day, you can write it down in your white book and keep track of your totals there. If your weight is progressively going up, you'll want to go in and see your GP because you may have to go back on some diuretics just for a little while to get a handle on it. If you are on a fluid restriction or if you're advised to be on a fluid restriction, make sure you do maintain that one at home as well. And if you become increasingly short of breath, you want to go in and see your GP. As for diet, it's a good idea to maintain a diet that has lots of fruits and veggies in it, as well as low salt and low fat, and to drink plenty of water, so long as you're not on a fluid restriction. If you are, keep going on that until you're advised not to. The Heart and Stroke website and book are also good resources for this as well. As for alcohol, I would wait 2 weeks after your surgery or after you're discharged before you start consuming alcohol, and when you do, just start in moderation with your alcohol and just make sure you've double checked with your pharmacist to see if there's any interactions between alcohol and your medications. When it comes to having bowel movements, it's very important that you're not straining when it comes to needing to have one. In order to make this easier on yourself, make sure you do have lots of fruits and veggies. You may need to increase your bran intake, have whole wheat carbohydrates, and if it's becoming a problem for you, then you can talk to your GP or your nurse practitioner about maybe getting a few laxatives on board or stool softeners. When it comes to exercise, you've already started your walking program here in the hospital by doing your 3 loops around the ward. You're going to continue that at home and you're just going to start building on it. So once you're at home, do about the same as what you did when you were here in the hospital, and then you're going to gradually progress and extend your walks by about 2 minutes each day. You're going to keep doing this until your walks are about 20 minutes long. And then you're going to drop one of the walks and you're going to walk twice a day and work to about 30 minutes. Once you've hit 30 minutes, you can drop another walk and you want to work your way up to about an hour long. Your goal is to walk about 30 to 60 minutes for most of the days of the week. Now on those undesirable weather days for walking, you can walk in the mall. Once you are comfortable and you're probably beyond your 6 weeks, you can start working on a treadmill or you can work on a stationary bike as well. You want to keep protecting that sternum, whichever activity it is that you're doing, for 2 months or until your bone is completely healed. And 2 months will allow that to happen. More information on protecting your sternum and physiotherapy aspects of your at-home journey can be found in your white book as well. When you're starting to exercise, make sure you're doing a good warm-up as well as a cool down just to help your body recover from your exercise. It's a really good idea when you're first starting out is to walk with a buddy just until you start to feel comfortable with the walking routine, and always make sure that you or your buddy have a cell phone on you just in case you need to call for help while you're out. It's a really good idea when you're walking to plan a route that has benches on it so that you can stop and rest at any point during your walk. And I would keep doing this until you're comfortable doing a route that is non-stop. Keep doing flat ground for your walks. Keep walking on flat ground until about 4 to 6 weeks, and then you can gradually start adding inclines and uneven ground to your walks. When you're out walking, you always want to make sure that you're able to talk comfortably, and you never want to be gasping for air when you're walking. If you are, you're going a little bit too hard and you need to just rein it in a little bit. If any of the following things happen, chest pain, jaw pain, arm pain, angina-like symptoms like you had before your surgery, excessive sweating, dizziness, nausea, irregular heart rate, extreme pounding in your head, or any really severe joint pain or muscle pain, you want to stop and rest what you're doing. Give it about 20 minutes. If any of these symptoms don't go away, then you want to come into the hospital. If they do go away, rest a little bit more. You can continue your activity, but at a slower pace. Formal cardiac rehab usually starts around 8 weeks, and once you've been cleared by your cardiologist or your internist. If you live in Victoria and you've had bypass surgery, the hospital will refer you to this program and you'll get a call from the hospital. You can resume sexual activity when you feel comfortable doing so and when you feel that you have enough energy. But it's really important that you still are maintaining your sternal precautions and protecting that breastbone. So this is usually on the bottom position. As I'm sure you are already aware, after open heart surgery, you can go through a whole range of emotions from fear, sadness, depression, mood swings, anxiety, the whole gamut. And it's usually the case that these will go away once you're a bit more secure and confident in your daily routine. It's important to keep talking to your family and your friends when you're feeling this way. And if they don't go away after a couple of weeks, then you can either self-refer to a clinical counselor in your local area, or you can go and talk to your GP or your nurse practitioner and they can help you out.